we've come off the back of two previous experiences of biosecure environments. The first was the England tour, and the second was a Sri Lankan tour. So we've learned a number of lessons from both of them, and we've engaged with Cricket Australia over a period of a few weeks in terms of what their requirements were. Their requirements were far more stringent than any of the other previous kind of BSEs we've had, and therefore we kind of reconfigured the BSE environment for the Australians. Now, some of the things which were very different to what we've had previously was all of these hotels that the Australians were going to use and that we were going to use were going to shut down for 14 days prior to the entry of both teams. So that means that the staff, for example, at the Irene Country Lodge, where the Australians were going to live, was going to shut down for 14 days. All of the hotel staff who were going to service that biosecure environment were going to be confined to their rooms for a period of 14 days. Their meals were going to be eaten in their rooms and delivered to their door by fully clad staff in PPE. So just gives you an idea in terms of the biosecure environment, how much more stringent it was going to be. And during that period, we were going to test staff on a regular basis. And when the Australians arrived here, everybody within the BSE was going to be tested every 3 days. Now, again, this is already a huge guarantee that the probability of infection would be extremely low. Um, in terms of the stadiums, they've taken similar precautions for catering and for the use of the change room attendants. Supersport has come to the party with virtually zero contact between players and commentators or any of the cameramen. So in short, the BSC was kind of a strict environment where the contact with anybody from the outside was minimal. People contracting infections within it was minimal as well. Over and above that, we've kind of got uh, a commitment from Netcare Hospital Group that they would guarantee us a hospital bed should anybody require it. We got guarantees from government that the Australian team will be protected and granted safe passage out of South Africa should the need arise. We invested in technology to ensure that tracking of individuals was monitored on a regular basis. And if there's any close contact that we could trace contacts quite easily using the technology. We had COVID compliance officers who were going to monitor CCTV cameras on a regular basis. So basically, it was a strict biosecure environment. Everything that Australia had required, we had checked the boxes. Even as far as the airport is concerned, we were working towards granting them a safe passage, coming with a private charter from Australia, giving them a private terminal to land in, getting dedicated staff to check them through with customs and with health, and with immigration, and ensure that they go in a biosafe bus to the biosafe environment. So I mean, the last bit of our discussion was Australia, was that we decided, because Australians were concerned about crossover with the South African team and with staff supporting South African team, we decided to create two separate biosafe environments at huge additional cost to Cricket South Africa. I mean, the other thing that we as Cricket South Africa did is, because Australia insisted that our players quarantine or come straight into the BSE from Pakistan, we sent an entirely separate T20 team to Pakistan with all the test players coming back and none of them kind of moving to the T20 except one or two of them. So we've kind of created this kind of at huge cost to Cricket South Africa. We've kind of attempted to accommodate the demands of Cricket Australia. Cricket Australia based a decision on zero risk, and I think that zero risk in this world is impossible. We worked on probabilities; they worked on possibilities. So clearly, we went as far as we could, taking all the precautions, with a kind of fair degree of certainty that there would be no positive cases within the BSE. But I think that, I mean, there's a couple of things that the Australians were concerned about. They were concerned about the 14-day hard quarantine when they returned to Australia. If an Australian player tests positive in South Africa, it would be difficult for them to get back to Australia because they could not board the charter flight back to Australia, and then they would need a commercial flight back to Australia, and the Australian government would need to grant them permission to get back into the country, which wasn't guaranteed. So there were certain imponderables which Australia faced from their government demands, and certainly that was way beyond our control. I mean, we've had a couple of things on the run at the same time. I mean, we've got our tour to Pakistan where we had to ensure that there was a biosafe environment for our players going there. We were preparing for the Australian tour coming in. You know, we had the back of the Sri Lankan tour and the English tour where we learned from. And the Australians had spoken to the English and to the Sri Lankans, so they knew what the chinks were, and we remedied all of that. We've run a domestic, the Momentum One Day Cup very successfully. We've hosted the Pakistan Women's Series very successfully. We currently have a Cubs Week which is running. We've got the T20 domestic competition coming up, and I mean we've run these competitions fairly successfully. I mean, we've had positive tests, but we've managed them very, very kind of uh, responsibly. So we haven't had spread of infection within any of these BSE environments. With Australia, we had certainly taken it to a different level, and the level of risk was close to zero. I couldn't guarantee a zero risk, but it was close to zero. Graham and I and our teams have invested an enormous amount of energy and an enormous amount of money into ensuring that this tour goes ahead. Um, so clearly, I think it's disappointing for all of us that Australia has taken this decision, and very late in the day as well. So, I mean, the other redeeming factor for us is that the number of infections in South Africa has gone down to 25% from when we had begun discussions with Australians. So clearly the risk in the country has come down significantly. The vaccination program is being rolled out. Clearly, it wouldn't impact on Australian series, but we're beginning to see huge changes in South Africa in terms of risk, and the risk has dropped significantly. So within this climate, I mean, we're really disappointed that the decisions the Australian Cricket Australia has taken.